Good evening. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and to my right, Dr. Christensen.
Good evening.
He's here again. We're going to be trying to do in the tandem thing. This is again, the live show tonight. We understand that we had 1 week of technical difficulties where the producer had some other obligations, so we didn't get to do the show. And then, of course, we had the Memorial Weekend where we were off and took the opportunity to be with our families and loved ones, and so we did not do a show. And as you know, tonight we never script our show because we want the callers to call in and kind of lead us in the direction of where they want us to go with their different questions, so we can answer those. And you know, I love having Dr. Christensen here because, you know, when it comes to chiropractic and musculoskeletal injuries and things of that nature, he's always the fill-in to help with that.
Thank you.
Now, one of the things I wanted that came up in the office today, and it kind of pertains to you too, Creig, which is, you know, when people have pain, very different types of pain, and well, we're going to interrupt that thought for our caller, Ray. Ray, good evening.
Good evening. Ray the Flagman here.
How you doing tonight?
I'm doing all right. I want everybody out there to know that today is D-Day. A lot of people forget about these important dates. I was at the courthouse today, and I was telling people, I said, you know, I got to hit the street. If the flagman can't be out there on D-Day, what good is he? I might as well just wrap the flag up and put it in the car and never bring it out again. Mm-hmm. So I went out there for 35 minutes, and believe me, it taught me a lesson. It's kind of really tough when it was almost high noon.
Yeah.
So, but anyway, I had to do it on D-Day, and I hope everybody says a prayer for the ones we left behind.
Yep.
And I dedicated my walk to all those boys and men that died on that beach, you know, 72 years ago today. All right, my questions for you, two things. Essential oils. I've been researching essential oils, frankincense and myrrh, and they seem to have a beneficial quality to them. I wonder if you could comment if you know anything about them. And the second thing, Doc, is I have some friends who have urinary tract infections, and they don't know what's causing it. We're talking men. And I'm not talking STD, just older guys that have problems. All of a sudden, they just they have these infections. They can't control their bladder. Is there something to stop that, or is it just natural that just happens to some people? And I mean, I'm getting phone calls where people are really in agony about this, and I don't know if it's diet. I don't know what to tell them. So, if you can explain essential oils and the urinary tract infections, I'd appreciate it, and I'll call in later in the show also. Thank you very much. Welcome back.
Thanks. I don't know much about essential oils. Do you?
Yeah, I don't have a tremendous knowledge on essential oils, although the massage therapists in the office are using them. I have seen some amazing things with frankincense, with the aromatic oils as they work on patients. It's amazing to see what goes on with them. It's kind of new. The oils are well, they're not new, they're old, but I mean, they're making a resurgence in the industry. But I have seen some pretty amazing things with the essential oils.
Well, and I know they use oils from the hemp and the marijuana derivatives, which have been very helpful for arthritis and things of that nature. So, and one of the things I don't know what the active chemical compound is, but in medicine, a lot of the products that we give that are topical actually have to have a vehicle, which means an actual product that actually, and I guess I use the term vehicle because that's what it is. You can have a compound, a chemical, and you put it on your skin, but your skin is really impermeable to most substances, okay? So in order to get that substance through your skin, you either have to use a transdermal injection, which is air to force it into the skin as they do with some injections, or you have to have a vehicle that actually can melt into the skin and get it into the skin. And so therein lies, and I'm going to digress from there, but therein lies why we get contact dermatitises. Contact dermatitises are things where we put it on our skin and we're not necessarily allergic to it the first time we do it, but the vehicles in the products actually put those products into our skin and they get them into our circulation. And then they combined with another substance called a hapten, H-A-P-T-E-N, and that actually gives it a recognition to the body's immune system. So you get it into your system, it combines, and then it attaches to, becomes recognizable, meaning by itself it's nothing, but when it attaches to the hapten, the immune system can pick it up and then develops an allergy to it. So therein lies why people can say, well, I've been using this for years and I've never had an allergy to it. Well, you've developed it over time because your body has had a chance to process it. So, and I know that's different than what the essential oils are, but a lot of it to me is what they call an allopathic physician. You know, I'm not trained in the natural healing arts. Everything I learn is by what patients tell me or things of that nature. You know, there has to be, we're evidence-based medicine where you have a new medication. It goes through what they call a double-blind crossover placebo study, where you give a group of patients the medication, then you give a group of patients an identical-looking control, and then you cross them over, and you see the statistical difference. And then when you measure that statistical difference, then and you just get the desired effect, then you get a statistical difference, and the medication has approval for that indication. But you know, like I said, the oils. Now, as far as, you know, like I said, the marijuana oil tends to be wonderful for arthritis. And one of the products I use a lot is topical Voltaren gel. And you'll see a lot of my patients coming in there on that. I love this product. It is Voltaren in a gel. And Voltaren, as you know, is diphonac sodium, which is a non-steroidal. But the theory behind it is that if I give you a 50 milligrams of Voltaren or non-steroidal and you take it in by mouth, it's got to go through your intestinal tract, it's going to get in your stomach, and there's a thing called bioavailability. Not every drug, 100% of what you take is going to be absorbed or be available to you, so there's a percentage decreased circulation in the stomach, food, what time of day you take it, things of that nature will determine what they call bioavailability. So as we take in a drug, we get that bioavailability, and then from that comes how much you get in. So 50 milligrams might be 20 milligrams dispersed through your body, where you're going to get the effects of that drug on your joint and everything else like that. Well, what the Voltaren gel does is it gets you 100% on your skin, you get 20% to the joint, okay, and then you get 4% dispersed through your body. So you don't get the effect of this medication being dispersed all through your body. First, you get a secondary absorption, and it reduces the secondary side effects. And you get the topical placement in the joint, which is very good for you.
Yeah.
And I've seen it, it's indicated only for degenerative arthritis in the fingers and the knees, but I use it on backs, I use it on shoulders, you know, and I would suggest that if you have any type of blood pressure problem, that, you know, they're going to get the same black box warning as non-steroidals, because it is a non-steroidal. So it's going to affect your stomach and your blood pressure of all those things. But trust me, you're getting 4% through your body as opposed to 100% through your stomach and everything like that. So we have Mary Ann on the phone. Mary Ann.
Hi, Doc.
How you doing? Hello?
Hello. Hi, Doctor. How you doing?
I'm good. What can I do for you?
Well, I'm a patient of yours.
Okay, great.
And I started having nosebleeds 3 days ago.
Okay.
Every day.
The heat.
What would cause that?
What could cause that?
Yeah.
Well, there's a variety of causes for nosebleeds. Most of the time, they are just dryness in the air, and then your nasal membranes weaken and a blood vessel becomes exposed and then erodes. But as we get older, that's common in the younger population, called an anterior bleed, which is what they call a collection of blood vessels in the front of your nose where your septum meets the bone. That's called Kesselbeck's plexus. But as you get older, Mary, we have the risk of posterior bleeds, which are bleeds in the back of the nose. Those are very, very worrisome, and they can be very fatal because of the circulation in the back of the nose, okay? So my suggestion to you is that, you know, you get in to let one of us take a look at you. Let's get you into your ear, nose, and throat doctor so he can examine your mucous membranes to make sure it's not a polyp or a tumor or something else like that that could be causing that bleed.
Okay.
Okay?
You got it.
Okay, thank you for calling in.
You're welcome. Bye-bye.
Okay, bye-bye. Yeah, it's very important, and elderly people suffer from posterior bleeds as opposed to the younger bleeds. And of course, as we get hotter, you know, you get some nosebleeds in the winter a lot of times because of the dryness and the humidity, and this hot wind. I mean, I was out of town for a week, and I guess overnight it went to like 105. I mean, that's what I heard. But
Literally overnight.
Yeah, literally. And I was in Texas where we had this incredible amount of rain. But we're going to go on break, and we'll be right back and talk a little bit more about what we're talking about tonight. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.